Jamie Jenkins is a former head of health analysis at the Office for National Statistics and ran as a candidate for reform in the Senedd election. Good morning, Jamie.
Morning, Claire.
Indian variant, hearing around 57 cases here in Wales at the moment, likely to be more. What is your analysis of the rise and where it's going so far?
Yeah, I think the first thing probably to point out is we're clearly not where we were back in last December when the Kent variant was emerging, and then we saw this huge rise, and then we had the second wave. We're at a much different place now, partly to do with the vaccine rollout, partly to do with the fact that we've gone from spring out into summer. So inevitably we are seeing rises in cases, and as you've just been discussing with regards to Bolton, we're seeing the majority of these cases rising among kind of younger people. And Number 10 Downing Street as well have been kind of issuing some information regarding the situation in the northwest of England, saying they tend to be people who are not vaccinated or fully vaccinated are the ones who are lending themselves to going into hospital. And there has been a slight uptick in hospital cases in the northwest. But if we come back to Wales, we're not really seeing kind of big clusters like you're seeing in the northwest. What we saw last week is a cluster around a school in Cardiff, in the Curragh area. And that's kind of come out in the data now because we haven't seen that spread more widely. The next few days, looking at the data, we're going to start seeing some big clusters coming through in the Bridgend, Porthcawl part of the Bridgend area. And the key thing is tracking those so that they don't send themselves to kind of widen in the community. So the fact at the moment is that we got 14 patients in hospital. That's down from over 1,600. We've got no rise in cases significantly across the country. And remember, the key thing to track really now is, because of the vaccine, Claire, is the death statistics. And in Wales, they've been below average now for 10 weeks. And ONS in the next hour or so will release the latest update. And I expect that to be the same again today.
And Jamie, just important to mention as well, I mean, Dr Atherton yesterday saying cases in Wales are traceable back to a point of entry. And across the border, it is a different situation. Scotland and England, community transmission. Any signs of that here yet?
Well, no, we had this cluster in, say, in Curragh and Cardiff last week. And if you get this community transmission, what you would find is you get a cluster and then that kind of spreads more widely in the community. But the case rates in Cardiff have started to come back down. Newport was quite high a couple of weeks ago. That's come back down. So we're getting some localised outbreaks. And that's what you'd expect with this virus. Remember, we're not going to get rid of the virus. It's going to be here to stay, and we're going to have to learn to live with it. The case rate for Wales and the percentage of tests coming back positive, it just remained relatively flat overall. And looking at a map of Wales, and if people talk about the alert levels, and one of the indicators for the alert levels is the cases per 100,000. And if you map like lots of little local areas across Wales, 98% of Wales would be at low risk. You just got these couple of kind of hotspots across the country. But the good news is we're not seeing that lead to any increase in hospitalisations, and then that ultimately would lead to deaths because the vaccine's clearly doing its job.
And in terms of the next steps that the Welsh Government should make, I mean, we know the weather is set to improve, half term next week. I mean, in terms of people travelling to and from, do you think the Welsh Government should consider following UK Government and Scottish Government, either a ban or advise against travelling to variant hotspots, these places in England?
Well, it obviously makes sense to try and reduce the spread of, say, of any variant. If you know, like, for example, the Northwest has got some high cases, I think just some kind of common sense among the public to try and minimise the risks in terms of transmission across the UK to not go to those areas. I think as we go forward in the next kind of 4 or 5 weeks, the big thing in England, Claire, is whether or not Boris Johnson is going to be doing this big unlocking on June the 21st, which obviously the Welsh First Minister, Mark Rayford, hasn't said the same thing in Wales. So I think in England, they're more tracking this in terms of how is this going to affect what's going to happen on June the 21st. We've not got the same kind of promises in Wales, but I think you're probably right on this one. Yeah, just some common sense, avoid some of these high areas. That will avoid bringing the kind of the variants and spreading them more in the community in Wales.
And Jamie, just looking at what, you know, the analysis and the figures, the stats you're looking at, what is your expectation from where figures will go from here? Are we expected to see many more cases? I mean, Frank Atherton yesterday saying we should be worried about a resurgence of coronavirus.
Yeah, so I don't share the kind of the more doom and gloom scaremongering that sometimes goes on with cases are going to rise, because I think inevitably that's what's going to happen, because the virus isn't going to go anywhere. what we've got to learn to look at is the cases that lend themselves to serious hospitalisations and deaths, and the vaccine's kind of offering the hope for that. But remember last summer, we didn't have a vaccine then, and we saw cases come down quite dramatically, and we might see a similar pattern here. The key thing is going to be, as we come out of summer, we went into last September and we started seeing cases rise. With the vaccine, and several different versions of the vaccine as well now, Claire, the link between cases and hospitalisations and deaths clearly has been broken. And as the vaccine rollout continues, like say in Wales now, over 80% have had the first dose of the vaccine, and we're approaching a significant number with the second dose. I think the key thing is to track hospitalisations and deaths, not just cases, because inevitably the vaccine, whilst it stops people kind of getting seriously ill, it also helps stop transmission. It's not going to get rid of it completely.
Jamie, good to talk to you. Thank you for being with us. Appreciate your time. Jamie Jenkins, their former head of health analysis at the Office for National Statistics.